Clinical studies have shown that cerebral desaturations are common, and in fact, occur in more than 50% of all cardiac surgical cases, which may increase the risk of post-operative cognitive dysfunction. In this INVOS demonstration, we will show several common clinical scenarios that can lead to cerebral desaturation.
The demonstration we're going to do right now is the recruitment maneuver. And this is a maneuver that's done every day in the NICU to reinflate the lungs of the baby. And you will see that we're going to have profound hemodynamic effects. So I'm going to ask you to stop ventilation and inflate the lungs to 35 centimeters of water. And we're going to hold that for 40 seconds. Look at the blood pressure and the cardiac output is going down. The INVOS monitor is going to start showing a decrease in cerebral blood flow and also in the renal blood flow. In a baby, you cannot monitor anything but mean blood pressure. So the INVOS is the only one that will tell you whether flow is going down. And you can allow the patient to breathe again. So we dropped the leader in cardiac output, and you can see the pronounced change in saturation. But look at the oxygen saturation in arterial blood. It's normal, did not even change. So there's nothing to tell the clinician that this was really bad for the patient. The next procedure we will do is remove blood from the patient to demonstrate how sensitive the INVOS monitor is to changes in hemodynamics. So we're going to take out first 20% of the patient's blood volume. You will observe that the saturation will come down in a stepwise fashion here. The arterial saturation is not changing. And so far the blood pressure has not changed. And you can see that both the blue line, which is the cerebral saturation, and the red line, which is the somatic saturation, is starting to go down. I still have no other clinical indication that something is going on. Okay, so I have now removed 20% of the patient's blood volume. Now we're going to remove an additional 20% of the blood volume. Okay, there was another 60. Now you can see changes in blood pressure. So that is a very delayed reaction compared to the change in saturation on the INVOS monitor. Okay, there was another 20% of the blood volume. And now you can clearly see the mean blood pressure is 34. The patient is in hypovolemic shock at the moment. The pulse oximetry has not changed at all. So that is not an indication that we're in bad shape. But you can see how quickly cerebral saturation fell. As soon as I started to remove blood, saturation fell. There was no other indication of bleeding. Now I will resuscitate the patient by giving a mixture of blood and saline back. So there was 80 milliliters of lactated Ringer solution. Now we're going to do some blood on top of that. And you can see already on the cerebral saturation that it is starting to trend upward. We have no indication on the EKG or arterial saturation that anything has changed. We have a little bit better blood pressure, so that's a good thing. And you can see now, when you see more of the trend values on the INVOS monitor, how you see the steps where I removed blood on the somatic line. You see the first 20%, the next 20%. So that's how sensitive the monitor is to changes in blood flow and blood volume. Now we're back to normal cardiac output. We're back to baseline on the cerebral saturation, and that concludes our demonstration. And for all of the various models we tested, you can see how rapidly the INVOS responded.
As you can see, INVOS offers the earliest indication of changes in hemodynamic function. Clinical evidence has shown that the INVOS measurement can have a profound impact on patient care and outcomes. A majority of the top adult and congenital cardiac surgical centers are currently using the INVOS system today.